All right, you wonderful humans, let's get this party started. It's Saturday, April 12th. Thank you for being here. For all the people who are participating on Zoom, all the people who have butts in seats, we greatly appreciate it. And of course, everybody watching it after the fact. I just like to remind everybody, I always record these workshops that we hold on Thursdays and Saturdays, and these are client exclusives. So these workshops are one of the benefits of being a client here at 3D Wellness. We produce quite a bit of content. We already have about 250 different YouTube videos, and we're adding about 2 a week right now. But these workshops are listed privately on YouTube, and only clients get access to them. So that's one of your benefits. Today, our simple supplement strategy workshop is all about joint health and mobility. As always, there is a handout prepared for it. Everybody who's here has a copy of it. Everybody watching it after the fact and on Zoom, you can always request a copy of this, either like a physical copy or a digital copy, and we can email that over to you. Let's jump into it. Joint health and mobility. Joints in our body are unique and complex. In this workshop, we will cover the basics of joint anatomy, some simple food strategies, and the supplements that I've used throughout my career to support joint health. There's some key terms that I want to make sure everybody understands before we move forward and start to get more in depth. The first is the term joint, a point where two or more bones come together, allowing for movement. And this is where I want us to understand how complex joints are. It's any spot where two or more bones come together, but think about how different the joints in my finger are. They can only straighten and curl at one angle, compared to what a shoulder can do. There's all sorts of rotation happening in here and movement across multiple planes. So the term joint actually encompasses quite a bit of different things in the body. A ligament, and I often hear clients mix up these two words, so I had to add it to the handout. Ligament is a fibrous tissue that connects bone to bone. Think of it like a super strong rubber band that connects one bone to another bone. That's a ligament. It helps us move a joint. And tendon, a fibrous tissue, so another really strong rubber band that connects muscle to bone. And muscles pull on bones. So the difference with those two is that one is going bone to bone and one is going muscle to bone. They're both necessary in terms of being healthy to allow a joint to move the right way, to be able to put strain on that joint and have nothing bad happen to that joint. Next term is arthritis. We hear a lot of clients throw this one around. I especially like it when clients call it arthritis. I don't know who Arthur is or why he had this condition named after him, but it's actually just arthritis. A general term for joint pain, swelling, or degeneration. We're going to talk about minerals today, and we're going to talk about hair analysis a little bit. Arthritis being such a general term, it's often a catch-all. It's used when there's not a lot of certainty as to what is causing the pain or the swelling or the breakdown in the joint tissue. In our office, what we prefer to do is look at what's going on in the minerals inside of your body and see if imbalances or deficiencies or even excesses there are causing the condition that's developing in your joints. And then bursitis. This is different. Joints are cushioned with fluid-filled sacs called bursa. Bursitis is an inflammation of these sacs. So I have a lot of clients who come in and they get a diagnosis of bursitis. And what I want us to understand is that in our joints, whether it's a finger or a shoulder or a knee, whatever joint it is, we have little cushions in there, and those can get inflamed totally separate from a tendon or a ligament or a bone. So it's just another way joints are complex. We're going to talk about a lot of different nutrients today. And the reason we're going to talk about so many different nutrients is because when we're dealing with joint health issues, we might be dealing with bones, we might be dealing with tendons, we might be dealing with ligaments, we might be dealing with a diagnosis that isn't totally specific, and we might be dealing with little fluid-filled sacs. So we're actually talking about a lot of different things when we talk about joint health. Now those are the key terms. I want to go to minerals next. Before I do we have any questions coming up? We look good on Zoom. We're good in the room. Cool. All right, I'm going to see if I can do this from memory again. I think I got this. When you look at a hair analysis chart, there's a couple of things we should notice. It always lists all the minerals: calcium, magnesium, sodium, potassium, iron, copper, manganese, zinc, chromium, selenium, and phosphorus. Every hair analysis we run here at 3D Wellness, we check all these mineral levels. And above the name of each mineral, we have a score, and that's your level. So if you're looking at your hair analysis ever, right above the mineral's name is your score. And then separate from that, there's a gray dashed line that goes across, and that is the ideal level for each one of these minerals. When we're talking about joint health, there's 3 minerals that are especially important: calcium, manganese, and phosphorus. Calcium has a lot to do with structure. And that probably makes a lot of sense to you, just because we know bones are really hard, which means we can build a structure on them, like you can use 2x4s to help you build a house. Manganese is also structural, but it is also for movement. Calcium just needs to be stable. We need to have it so our bones are strong, and so we can put pressure on them via a joint, a spot where 2 bones come together. Manganese also helps us with some of that strength where 2 bones come together. It's also very important for movement, because I mentioned those tendons and ligaments, those fibrous tissues in the body, are a lot like super strong rubber bands. And manganese is what allows these rubber bands to stretch and then go back to their original shape. And without adequate manganese, what happens to a lot of people is they can get a joint to stretch, they can get a tendon or a ligament to stretch, but then they don't feel like it quite goes back the same way. Another way to put this is a lot of manganese deficient people are the people you hear about. They say, "Oh, I hurt my back. All I was doing was picking up something like normal. Oh," and something went out because they stretched something, and when they went to put it back and stand up, their body didn't have the manganese to snap that rubber band back into place. Yeah, you're all thinking about shoveling snow right now, I can tell. And phosphorus. This one helps balance calcium. It's also the cleaner. Okay, that's a really big deal. Joints can accumulate junk. You've probably heard the term bone spurs before. That's one of the most common things that can mess with a joint, because a joint is a spot where 2 bones come together. So obviously if we have some kind of funky protrusion in there, it's going to mess up the joint. Instead of being locked into place, there's an extra piece sticking out that could really mess with that joint. When we have adequate levels of phosphorus, we can clean out joints and help the body resolve or even prevent things like bone spurs and other junk accumulating inside of a joint. So on the handout, it says key minerals, and there's 3 of them: calcium, manganese, and phosphorus. We want to get all of those up towards that ideal level. Questions on that idea? You're all going to go home and look at your hair analyses, I can tell. Maybe I should start telling clients before these workshops to always bring their hair analyses, because I try to work in the hair analysis to everything, since all the clients here have a hair analysis done at least once. All right, onward. There's a lot of foods that can help with joint health. And I know it's a simple supplement strategies workshop. Can't help myself. Got to go over some of the most basic things food-wise we can do to help joint health and mobility. The first is collagen. A lot of you recognize it. These proteins contain the nutrients a joint uses to maintain elasticity. Clinically used for people who have stiff joints. If you're really paying attention, you're thinking, hey, Drew, I bet that manganese mineral that helps with elasticity and collagen go very well together, and you would be correct if you're thinking that. So stiff joints respond very well to collagen. Next food is gelatin, and this one is also here in our office all the time, but is not used as often clinically. These proteins contain the nutrients that support joint health structurally. Clinically used for people with unstable or degrading joints. If you're still playing along, if you're still really thinking, you're saying, Drew, that sounds a lot like calcium. And yes, most people who have calcium-related issues in their body, including bone density issues, typically do better with gelatin than they do with collagen. If you really want to get fancy, and we're going to talk about it in just a minute here, you can do both. Nothing wrong with doing both. Bone broth is the next food on here. One of the most nourishing foods in the world, contains collagen and gelatin. So you can take it supplementally. Those are technically foods, they're just powdered foods. But bone broth naturally gives you both collagen and gelatin. And then seafood. It's rich in omega-3 fatty acids and trace minerals. Structural and anti-inflammatory support comes from seafoods. It doesn't just mean fish or shellfish. I'm also talking about sea vegetables like kelp, which is an ingredient in supplements like trace minerals B12 and Mintran and organically bound minerals, some supplements we use pretty regularly here. If you have additional questions about omega-3s, those good fats, we did a workshop, I think that was 2 months ago now, maybe 3 months ago. But of course, we filmed it. It's a client only, it's one of those benefit videos. It's on YouTube. You can ask us for that link at any time and the handout that accompanies it. Those are the 4 foods I tell clients to eat when they're having joint health issues. Those are the 4 I recommend to clients when they're having joint health issues. Questions on those foods? Look good on Zoom. You guys are making it too easy. I know it's Saturday, but you can still make me work a little. All right, next is going to be supplements, and I got them all lined up here. I think I put them in the right order, maybe slightly out of order. Is that Calcifood? Yeah, beauty. All right, the first one is Calcifood. This is cold processed whole food bone support. Now, I like to make a big deal about this one, as this supplement's more than 70 years old. And when it came out, whole food bone support supplements were actually pretty common. They are not as common today in our modern world, even though they are far more needed in our modern world than they were 70 years ago. But many of those other supplements that were made 70 years ago, while they were whole food, they were heated to extraordinarily high temperatures, which damaged a lot of the nutrient in the product. Calcifood, by standard process, is not heated above 108 degrees, which means the nutrients stay intact. I want you to think about this supplement like it's bone broth with extra calcium and phosphorus, which we know, calcium, phosphorus, we know we need those ones. So this supplement's like a bone broth supplement with extra calcium and phosphorus in it. Yes, so if somebody, that's a good question. If somebody doesn't like bone broth, taste, texture, whatever it is, could they use Calcifood as a replacement? That's the first thing that would come to mind for me. Yeah, good question, or good statement. All right, C Synergy is the next one on here. It's the parts of the vitamin C complex that support collagen formation in the body. Okay? And it bears us going over vitamin C for just a minute here. I'll draw it up there. When we think about vitamin C, too often we think about what we can find at a Costco or a Walgreens or a Walmart or a vitamin shop, and that's ascorbic acid. When you flip over most vitamin C supplements, you see some part of the word ascorbic or ascorbate, and that is just part of what the vitamin C complex is. Vitamin C, when it's in its true form, is more like a pie It's made out of multiple pieces. Okay? And ascorbic acid is absolutely part of that pie, but as you can see, it is not the entire pie. There's something called P factors, there's K factors, and then there's bioflavonoids. Okay? All of those things together is what truly makes vitamin C. And what Standard Process has done is they've made about a dozen different vitamin C rich supplements, and each one emphasizes a different pie piece or a different group of pie pieces while still providing all the pie pieces. Okay, so I'm going to say that a different way. Okay, some vitamin C supplements from Standard Process help collagen. Some other ones are better at helping your immune system. Some other ones are better at helping your circulatory system. Yeah, so the brilliance of Dr. Royal Lee, the guy who started Standard Process, he happens to be right here. This is one of the best birthday presents I ever got. He's always watching us. He's always here with us. Love it. Part of his brilliance was seeing how many different applications vitamin C had if the supplements were made correctly. So C Synergy has the parts of the C complex that help collagen the most. Next is glucosamine synergy. A lot of people know glucosamine. It's widely studied and it's proven. This is glucosamine with added whole food ingredients. So this is way more nourishment than your average glucosamine because it has whole food ingredients added to the glucosamine. So think about this product as joint lubrication and stability. A lot of clients get little clicks or little screechy, scratchy sounds when they move certain joints, especially hips and knees, sometimes shoulders. If that's what's happening, my first thought is usually glucosamine synergy, because we just want to make sure all the joints are lubricated the right way so they can move smoothly. Next one is one of the twins, Ligaplex 1. This is acute support for strains and sprains. This one, compared to the next supplement we're going to talk about, has much more anti-inflammatory activity. So the idea with this one, it'll still help repair a joint, but it's more so like, oh, I just sprained my ankle playing basketball, I just hurt my back doing yard work, that kind of thing. The first thing we have people do is Ligaplex 1. So think of it like most people use Advil. Oh, I just hurt my body, I'm going to go pop an Advil. Instead, what you could do is actually take some Ligaplex 1 and help nourish your body while still fighting the inflammation. And it is different from Ligaplex 2, Ligaplex number 2 if you want. This is a combination product just like Ligaplex 1, but it's more so for joint health and athletic performance. I have clients think about this. It's like a multivitamin for an active person. It's got 8 different Standard Process supplements all blended together in it. It's got heart support, it's got joint support in it, it's got vitamin E, it's got a whole host of minerals. If you're active, and it doesn't have to mean you're an aspiring professional athlete, just if you're active regularly, maybe you own a really large property and you take care of it yourself, drag and brush and doing stuff like that, mowing the lawn. Ligaplex 2, even just 1 or 2 of these a day, makes an incredible multivitamin for an active person. Both of those, the Ligaplex 1 and the Ligaplex 2, incredible whole food sources of manganese, this structural and movement related mineral. You know I was going to talk about this. Spanish black radish provides sulfur, which is a critical mineral for joint health. You do not see it on the list on the board right now. That's because the hair analysis lab does not measure sulfur levels. We do know sulfur is really important for that elasticity factor. It works hand in hand with manganese. So when you think about Spanish black radish, think, of course Drew found a way to sneak his favorite supplement into every workshop. Oh wait, it has sulfur? Ha! My joints need that. Yes, I do try to work it into every single workshop that I do. It does also apply to joint health, just for the record. Now we're going to get into some herbs. When we talk about herbs, first thing to keep in mind is herbs are perfect for the impatient patient. You have a problem that you want to see get fixed really quick. Herbs tend to kick in faster than the whole food supplements. But for long-term support, we stick with the whole food supplements. So it's not either or, it's knowing how to apply them together. What comes first, what goes second, what's short-term, what's long-term. First herb is Boswellia complex. This herbal product supports inflammation response and waste removal via the kidneys. There's 4 different herbs blended in here. One of them is Boswellia, the namesake. Another one is turmeric. Everybody tends to know that one. And the idea with this product is it's not just anti-inflammatory, it's also got kidney nourishment in it, which helps your body clear waste, which is often part of the problem with joint health. Part of the reason we want our phosphorus level to be really good so we can clean the joint. And then this helps, once we clean the joint, to take the trash to the curb. So, think joint comfort and fluid balance. Yes, a lot of my clients who have water retention tend to benefit from taking this supplement also. Yeah, you could. So the question is, Boswellia complex is supposed to help with fluid retention or fluid balance in the body. Could you use that leading into your menstrual cycle if you're dealing with water retention? Absolutely. You can take Boswellia short term, it'll kick in quick. You could use it for 1 week out of the month. It would help you in that week, absolutely. I'm also thinking if you deal with other things related to PMS, like cramps, abdominal pain, lower back discomfort, that would be another time you could acutely use Boswellia complex. It's going to help the inflammation, it's going to help the joints in the area where the inflammation is, and the fluid balance in the body. It's a good question. All right, Gotu-Kola complex. This herbal product relaxes muscles. You can still drive a car after you take it, though. Supports blood flow to the skin and the brain and a healthy stress response. It's going to sound like a sales pitch when I say this, but this is Botox in a bottle plus calm. And I know that sounds like all of a sudden every woman on the planet is going to want to buy 3 bottles of it to make sure there's one at home and one at work and one in her purse. So wherever she goes, she has it. But this is incredible, incredible product. Really good for the brain, really good for the skin, the muscles. Easy to take. Last but not least, in the world of herbs, Herba Vital. This herbal product contains support for multiple body functions. It has immune support in it. It has anti-inflammatory support, adrenal health support, circulatory support. It's got a lot of different things going on in it. And typically when I put clients on it, one of the things they report is that it just feels easier to operate their body. Think about that for a second. If you have a little bit of discomfort when you're going up and down stairs or getting in and out of your car, or if you go to pick stuff up and you can't pick stuff up like you used to, feel strained on some level, Herba Vital might be the thing, because most clients report it's easier to operate their body when they're taking Herba Vital. And on this one, 2 a day does a world of wonders for you. Those are the supplements. Those are the simple supplement strategies. I'll tell you, I have a personal cocktail out of this group. And when I tell you this combination, you should be able to figure out what's going on with my calcium, manganese, and phosphorus levels on my hair analysis. Okay, you ready for this? Let's do this. So right now, part of my supplement program, not the whole thing, but part of it is Calcifood. Glucosamine Synergy, and Spanish Black Radish. Okay. Calcifood comes in wafers or a powder. I put a scoop of the powder, it's a rounded tablespoon, into my morning drink. By the way, we're going to be releasing a little handout in the coming weeks about what Drew's morning drink is. It's incredible, by the way. So I put a tablespoon of that into my morning drink. Next one is Glucosamine Synergy. and always Spanish black radish. So what do we know about Drew's most recent hair analysis? Okay. Taking CalciFood. So of course, I'm working on my calcium level. My calcium level is a little bit low. I want to see it come up by about 25-30%. Working on my phosphorus level because that's also in CalciFood. My manganese level is pretty good because I didn't have any of the manganese donors, but I am taking manganese best helper, which is the sulfur and Spanish black radish. So with these 3 supplements, I'm able to address all 3 of the most important minerals for joint health. That's really easy to do. All right, here on the handout, quick little bonus. Inflammation is a sign that the adrenal glands, remember you got 2 of those, 1 on each kidney, and they're about the size and shape of a walnut, not very big. Yeah. Inflammation is a sign that those adrenal glands are overworked and undernourished. Supplements that support adrenal gland health are often part of an inflammation reduction program. If you are dealing with any condition that ends in itis, talk to Drew about adrenal gland support. Talk to me about it. The idea being that itis means inflammation, and whatever word comes before it, that's the part that's inflamed. So on the first part of this handout, I mentioned arthritis. Arth means joint, so arthritis is inflamed joint. I also mentioned the word bursitis. Itis means inflammation. Bursa is that fluid-filled sac in the joint. Bursitis is inflammation of that fluid-filled sac. But any itis, talk to me, because chances are your adrenals are involved in some level, and we can learn a lot about your adrenal glands by looking at your hair analysis, especially the sodium and the potassium. Right, you wonderful humans. What are we doing on time? 31, okay. When I practiced this, it was 25 minutes, and I think we're at like 28 minutes right now. Feeling good about it. Oh, and even Zoom is telling me I'm running out of time. Oh, wait, Zoom? Don't try to sell me stuff in the middle of a workshop. There we go. Okay. Questions coming to mind about the material presented today? We're good? Beautiful. We're good on Zoom? Beautiful. All right. Thank you. Thank you all for being here. I'm going to hang out for a little bit. On Saturdays, I see clients after these workshops. I used to work every Saturday. Now I work 1 Saturday a month. And I know some people's work schedules, it's just way easier to come in and see me on a Saturday. So keep that in mind. If you ever need a Saturday appointment, look for the 2nd Saturday of each month. That's when we do our simple supplement strategies. Can you tell that I enjoy alliteration? Thank you. See you soon.